Shani Dyer. I'm the CEO of ARCS Australia. ARCS Australia is the association for people working on the development of therapeutics. The ARCS conference brings over 1,500 people across the sector in Australia, with international speakers coming this year post-COVID, which is really exciting. So the conference runs over 3 days. We have 7 concurrent streams that cover all the areas that are involved in the development of therapeutics. We have clinical research, regulatory affairs, pharmacovigilance. A new stream this year is medical information, which has been really popular. About 60% of the value of the conference is the engagement that people have outside the education sessions. Now, obviously, the education sessions are what people are here for. They provide the updates on the various areas that people are working in, changes to legislation, guidances, etc. But it's the ability to get people together to understand what each other are doing, and just that connection piece is just so important for our sector. One of the key goals that ARCS is undertaking over this strategic period is to implement the professionalisation of our sector. Whilst we've been very clearly developing products that have safety, quality and efficacy, we now need to work on the quality of our staff, their ability to develop products and have a safe pair of hands, and to work efficiently as well. So for ARCS, it's been the concept of building competency frameworks in the areas that our people work, and that's a really significant step for us. ARCS is going to be a professional body that both recognises and develops people into specific competencies that are required for the roles that those people are undertaking. This is the first time that we've done this. Many other sectors and other industries have done something similar. And it's about time that we did this, and I think ARCS is the body that needs to be leading that charge. One of the important topics that's been discussed at the conference is around the HTA review, and HTA is the Health Technology Assessment, and this is something that hasn't been reviewed for decades, and really with the new emerging technologies that are available, it's a really good time to step back and reflect on how we need to make changes and what those changes need to be. So clearly, fiddling around the edges with the HTA is not going to really cut it. We are looking for some really significant and strategic reforms. All the pieces that are involved in taking product to market are part of an ecosystem. So if any of those parts of those ecosystem fall down, then it actually affects the rest of the processes in clinical trials and regulation, reimbursement, and all those things that are going to bring product to patients more efficiently and more quickly here in Australia. When you have a regulator that has been working so closely with industry over the last decade, you can't just let them leave without some kind of recognition. At the ARCS conference yesterday, we recognised the service that John Skerritt has provided to our sector, the wonderful initiatives that he has been involved in initiating at the TGA, and also a leader in the regulatory space, influencing globalisation of regulatory reforms across the world. We did a little bit of humour, we did a little bit of serious stuff, but it was all just to recognise somebody who we've really valued in the role that he held at the TGA as the First Secretary of Health, the Department of Health. Some of the key highlights that John has been involved in over the decade have included implementing the Medicines and Medical Device Review. He was initiating digital transformation at the TGA, implemented the regulation of medicinal cannabis, which is one of the first in the world, so such a great outcome. And obviously rapid registration of COVID vaccines and treatments, that was integral to saving patients' lives. Such a great initiative that he was involved in really bringing all those vaccines and treatments on as early as possible, while still maintaining safety, quality and efficacy. And then of course playing a leading role in the harmonisation of regulation around the world.